3, 2, 1.
Hey everybody, we are going to talk about Medicare and Medicaid today. Well, we're actually going to talk about Medicaid. So we're going to talk about Medicare and Medicaid this week and private insurance. Things that are important that the reasons why we need to talk about these, not just specifically about generic insurance, is in healthcare, we cannot function. Most doctors cannot. I know most facilities, they can't actually run without at least Medicare. Now, not every doctor takes Medicaid. Only a certain number of them take Medicaid. And so, with that being said, when a doctor takes Medicare or Medicaid, we have to understand what it's like for those patients or what the process is for those patients so that we can understand when we look at that chart, if it's Texas Medicaid, if you're in the state of Texas, Texas Medicaid is what you can accept. You can't accept Medicaid from outside the state because it will not be paid. The bill won't be paid. Sometimes in an emergency room, they'll get emergency privileges to cover it. But that's even iffy in that situation. I know we had an Oklahoma patient once that we were able to get Medicaid services on that patient from Oklahoma to pay because of an emergency situation while the patient was here and couldn't get home. So, but you need to understand the Medicaid and Medicaid programs, which is Medicaid and CHIPS. CHIPS is, and we'll talk about that second. But we just need to understand the processes that you have to take, or the steps you have to take to make sure a patient gets care with Medicaid. So we're going to do a little basic overview. We're going to talk about how the program is administered, how it's funded, what services are available, and who and what venues provide those, and how the different kinds of delivery models. The models for Medicaid have changed over the last 10 years. The way that Medicaid is paid out, how patients get their services, all those kind of things. That's changed in the last 10 years. So what Medicaid is, and you do need to know, Medicaid is a jointly funded program. The government, the federal government, gives so much money to each state each year for Medicaid patients or people who qualify for Medicaid. Medicaid is a program that's based on financial need or in some cases medical need. There is a limited number of people who can enroll and who are eligible. Medicaid covers, like I said, it's a federally and state-funded program. So every year the federal government gives a certain amount of money to the state of Texas, and then the Texas has to contribute a certain amount of money, and then they distribute those funds among people who qualify for Medicaid. So there are laws that regulate Medicaid. The Centers for Medicare and Medicaid, CMS, Centers for Medicare and Medicaid, they are the people who regulate Medicaid. Now, what that means is there are federal regulations for Medicaid, but the state can narrow that focus a little bit. They just can't supersede federal law. So federal law and regulation requires a certain population be serviced. It's based on income. And then if the government gives the state the flexibility to add additional population for services. So what that means is when we'll look at what the maximum amount of income you can have to qualify for these programs, but the state can say that they can raise that. So if maybe $28,000, which I think that's more than for one person, which I think it's less than that. But say a family can make $28,000 to qualify for Medicaid. Then what that means is that is the minimum the federal government says, but the state of Texas could say $32,000. So that's what that means, that they can branch it out to extend it past the age of 18 for children to 19 or 20, or the states can change what someone is eligible for. So it covers long-term acute care. Acute care and long-term care is what Medicaid covers. Acute care is basically when you have something wrong that needs immediate care. That means that you're going to the doctor's office, you're going to be in the hospital for a brief period of time. You need x-rays, you need outpatient services, like maybe you needed your gallbladder removed, you're going to go in for a day surgery. It covers mental health, labs, and x-rays. So please know what acute care means. It means something that is wrong that can be fixed and it needs to be treated right now. And it's going to go away shortly. It also refers to the health of children and pregnant women during their pregnancy. So what that means is children under the age of 18, if a child was born on Medicaid, so say a mom and dad qualified for Medicaid for an infant, for a pregnancy, that baby is covered for 1 year automatically under Medicaid. And then every year they have to reapply, in some cases every 6 months. Medicaid is an application program. You do have to apply for services. You have to provide income information and asset information. We'll talk about a little more about that later. But know that it covers acute and long-term care. Now, long-term care is different. That's for people who have chronic conditions. So people who have need for other support besides just going to the doctor. Maybe they are unable to drive due to disability. So this would be long-term services, would be disability related. Maybe they're going to be in the nursing home. Maybe they have to have rehab and then have to have home health, or they have to have someone come in the home, which is a community-based care program. They have to have someone come in the home to help them clean or cook or get their medicines or those kind of things. Also for long-term inpatient or outpatient behavioral care. So maybe someone needs to go to MHMR every month to get their prescriptions and to be checked up on. So let's look at the difference, acute versus long-term care. And the distinction is based on cognitive and medical conditions of the patient. So someone who has mental impairment or physical disability is going to qualify for long-term care as opposed to acute care. Needs for assistance with daily living. So if we have someone that has certain medical conditions, like maybe they have severe COPD and they have severe back pain and severe bipolar disorder, they may not be able to take care of their normal activities of daily living, which means like cleaning up the house, cooking a meal, making sure they get a shower safely, making sure reminding them to take their medicines. Those people might need that long-term care. And if their disability is chronic, so sometimes people have a back issue that they need surgery for but could not pay for it, and they've been disabled for a couple of years. They get their surgery and then they're able to go back into the workforce. At that point, that disability would change and it would go from being a chronic condition to an acute condition. Also, the different kinds of services provided. What do they need? Do they need long-term care in a nursing home and a long-term rehab facility? What do they need? And then where is it going to be provided? So home health, hospital, and outpatient services, those are pretty much acute care for the most part. But when you need community-based services, when you need nursing home services, when you need long-term rehab or what's called an LTAC, long-term acute care facility, sometimes they go from a long-term acute care facility to a nursing home facility. Those would make that a long-term care benefit. Medicaid, how many people receive Medicaid? In 2018, over 4.3 million people received Medicaid in Texas. 3.3 million of those were children, and 700,000 were either people over the age of 65 that were blind or disabled. So that's kind of a low number for the amount of people we have in the state of Texas. But that's the number of people who received Medicaid benefits. And as you can see, the largest percent of recipients were pretty much children, and the other percentage of those would be pregnant people. And I didn't add that, and I'm sorry. Okay, so Medicaid clients and spending. In 2009, this is kind of an older chart, but it's really hard to get statistics sometimes on this. As you can see, 61% of the people who received benefits in 2009 were non-disabled children. 9% were non-disabled adults, which generally is pregnant people, and then 30% were people over the age of 65 or who were disabled. Now, if you look at that in comparison to cost, 32% of the cost of Medicaid came from children, 10% came from people who were non-disabled, like pregnant women, and then 58% of the cost of Medicaid spending came from people who are over 65, disabled, that kind of, or blind, that in that population. So the state budget. So now you need to know how much we spend. We spend $127.4 billion of funds on Medicaid each year in the state of Texas. So $127 billion between federal and state money goes to pay for Medicaid. Medicaid amount represents 75% of all appropriations for Health and Human Services. So that's 75% of all the services. Now, just because $127 billion goes into Medicaid doesn't mean all of those funds are spent only for Medicaid services. You're going to see that we have what's called managed care in the state of Texas, managed Medicaid care in the state of Texas. We'll talk about that in a little bit. Some money has to be paid for that. It has to be paid for processing, the people who handle Medicaid, the people who run the programs. The money goes towards that as well. So both federal and state funding, both federal and the government oversee the Medicaid program. And for what happens is, like I said, for Centers in Medicare and Medicaid Services, and those are the people who oversee Medicaid for the government, from the federal government process. And what they're looking for is to make sure we're using our Medicaid funds and we're using them appropriately. And then federal Medicaid regulation requires that state designate a single state agency. For the state of Texas, it's the Health and Human Services Commission. So you need to know the Health and Human Services Commission, along with Centers for Medicare and Medicaid, are the people who manage and maintain and determine that all Medicare and Medicaid policy is taken care of. And they are also the people who change and deal with the agreement with the federal government. So Health and Human Services are the people who manage the state end of Medicaid. They change the regulations related to Medicaid, and they also make sure our agreements with the federal government are adhered to. The Center for Medicare and Medicaid are the people who manage it for the federal government. Medicaid eligibility, so people who are eligible for Medicaid. And sometimes you're going to have patients who do not realize they're eligible for Medicaid. We need to make sure that we help people. When they don't know they're eligible, we need to make sure that they understand that they're eligible for Medicaid. Low-income families who have children, they may be eligible for Medicaid. And when someone is eligible for Medicaid, they're also eligible for other programs, sometimes like food stamps and WIC and other social services programs to help them when they need it. Children in low-income families are eligible for services. Children who are disabled, children who are blind, adults who are blind, adults who are in need of a transplant, who have, we don't see this so often anymore because we don't have as big of a coal industry in our area, but people who are diagnosed with a need for some kind of transplant or for black lung, those are people who are eligible for Medicaid. Pregnant women, I mean, the difference in Medicaid eligibility for pregnant women and low-income families, the eligibility numbers are different. So if someone's pregnant, they may be eligible for Medicaid. We need to let them know. The people over the age of 65, if they pretty much, not everyone, but most people who only live on Social Security alone are eligible for Medicaid to help offset the cost of their Medicare. And people with disabilities, people who, like I said, who are blind, who cannot work, who have not worked in 2 years because of disability, they are eligible. Texas Medicaid does not currently serve non-disabled and childless adults. So people who, if someone is pregnant and they get Medicaid covers the pregnancy. It doesn't necessarily cover other services other than just pregnancy related. and it'll cover them for about, I think, 30 or 60 or 90 days after the baby's born, maybe just 30 now. But it'll cover them for a period after. Now, if someone is able to work and they have a certain income and they don't have children, they're not eligible for Medicaid. So you need to know who is and who is not eligible for Medicaid. Income and poverty level. So poverty level, the federal poverty level, is how we base what Medicaid is who is eligible for Medicaid. So based on their family size and their income level, if they're 115% above what is considered the federal poverty level, and that changes every year, then they might be eligible for Medicaid. So it's based on the family's income compared to the federal poverty level. You'll want to know that. Financial eligibility for Medicaid is based on the income level compared to the federal poverty level. And anyone whose income is at 115% or below the federal poverty level for that current year is eligible for Medicaid. It is intended to identify the minimum amount of income of the family who would meet certain basic needs. Now, that's why sometimes people who have Social Security only are eligible. Now, if they have a large retirement, they have a large savings account, they own a lot of land, they own more than just a home and a vehicle that they have access to, then a lot of times they're not eligible. And that's where we run into problems with our elderly. Sometimes they have an IRA, sometimes they own 40 acres of land that's been passed down to them. Those are things that make them ineligible. And so the federal poverty level indicates the annual income levels by family size, and it's updated, like I said, each year by the U.S. Department of Health and Human Services. So federal poverty level is updated, like I said, every year by the U.S. Department of Health and Human Services. And it's based on family size. So a family of 2 would have a certain income level, and it would be less than a family of 8. The federal poverty level for a family of 8 would be more than that of a family of 2. So we're going to look at that. This is the income levels in 2018. And I'm sorry, I updated this particular grid for 2011. Let me fix that date before I send that to y'all, and then we will go back. I hit 11 instead of 18, and so I'm so sorry. Let's get back to where we were. Oh, sorry. So as you can see, a single mother who is pregnant, if you have a monthly income of $2,039 or less, or $24,473, that person who would be pregnant would qualify for Medicaid. When it said adult plus children, that means a pregnant person. Now, if you are a pregnant person with a child, you could make $33,000 a year or $2,750 a month. So those would be like for one adult and a child. All the way down to there are 8 members in a family, then they can make $84,000 a year or $7,000 a month and be eligible for Medicaid. So as you can see, the amount corresponds with 100 to 115% of the U.S. poverty level. And so that would be for 1 to 8 people in the family. There must be children in the family. You either must be pregnant with a family size of 1, or you must have a household with children in that to qualify for Medicaid. If someone is an adult and they are not disabled, it could also be that 2,039, those first 2 have to be an adult plus children, or someone who is disabled, or someone who is over 65. That would be the qualifications. And once again, that changes every year. That was the 2018 income level. 2019, when I made adjustments to the slideshow, was not available. So Medicaid and Medicare. Medicare, we're going to talk a little bit about Medicare. We'll go more in depth on Medicare a little bit later. Medicare is a federally funded and administrated program. Medicare is completely federally funded, where Medicaid is federally and state funded. Medicare is federally funded only. Medicaid is state regulated, and there are some laws that pertain to it, but Medicare itself Medicare itself, remember this, Medicare itself is a law. It is a law related to medical benefits for the elderly and the permanently disabled. Medicare is a federally funded and administrated program that is federal law, and it is based on and completely managed by the Center for Medicare and Medicaid, and it is law. So where Medicaid has laws pertaining to it, Medicare is law itself. And it's important to note that Medicaid, not Medicare, pays for most long-term services and support. So Medicare only covers 100 days in a nursing home. If someone is for periods of illness. So Medicare will cover 100 days in a nursing home. At that point, if someone qualifies for Medicaid, Medicaid will pick up and continue to pay for that long-term care in a nursing home. If not, it has to be done by private pay. So Medicaid covers long-term care institution services and support coverages for the cost of nursing home, dual eligibility clients. Sometimes they have Medicare and Medicaid, or Medicare can continue to pay for prescriptions or other things if they have to go for certain kinds of doctor's visits. But the actual Medicare only pays for 100 days in a nursing home. After that, Medicaid or private pay, the family has to pay for that. Medicaid also covers community-based long-term care services that Medicare doesn't. Medicare doesn't cover someone to come in the home and help with activities of daily living. Persons who receive monthly SSI, which is a Social Security disability benefit, must wait 2 years before they're eligible for Medicaid. From Medicaid and Medicare both. They will get SSI, which is a Social Security supplemented program, and they can have Medicaid. After 2 years of being completely considered disabled, then they can receive Medicare and Medicaid on top of that with their SSI. And so Medicaid is their primary payer during those 2 years. Mandatory services, federal law requires that all state Medicaid programs pay for certain services and reimburse certain provider types. So the following things, every state must do early periodic screening and diagnosis, EPSTD, or early SDT, early periodic screening, diagnosis, and treatment. What that means is that it's in Texas, we call it the Health Steps program, and it's for people under the age of 21. And it includes a treatment for conditions such as regular checkups, where we can keep a medical history, where they get a yearly exam. They look at nutritional and developmental and behavioral needs. They do lab tests, immunizations, health education for a child that must be diabetes, health, vision and health screenings, and referrals to other providers as needed. So say someone that has Medicaid goes into the doctor's office and their vision is not what it should be, then they can be referred out to an eye doctor to get glasses. And Medicaid will pay a certain amount for frames and lenses, that kind of thing. Say they need to go see a cardiologist, or they need to go see a kidney doctor, a nephrologist. Those kinds of doctors, due to labs or due to different things being seen, they can be referred out for that. Mandatory services, you must be a federal qualifying health center. So federally qualifying health center. So that's a type of facility. It's a doctor that has met all of the requirements to be a federally qualifying health center. That means they haven't had any Medicare or Medicaid issues, that they can provide a bigger, broad type of care there. So that's why they like them to go to federally qualifying health centers. Also, home health care can be provided under Medicaid and in and outpatient hospitals. Those are things that Medicaid, that every state that provides Medicaid must allow those services for Medicaid patients. Other mandatory services, family planning and genetics education. So they must make if a facility has Medicaid or accepts Medicaid, they must give family planning, which is education on birth control, on genetic. They must be able to provide genetic testing and genetic counseling. They must be able to provide labs and X-ray. Mandatory services in the state. They must provide nursing home facility care under their Medicaid. Pregnancy-related services, rural health clinics must fall under that category. Physicians, midwives, and nurse practitioners, whether it's pediatric or family, states must allow those people to provide services. Optional services, prescription drugs are not, state by state can choose whether or not they have these services. Texas provides these services. We provide prescription services, physical therapy, occupational therapy, targeted case management. Targeted case management means that if someone is a diabetic, we send them for diabetic education, things like that. Some rehab services, so they cover physical therapy and speech therapy for some people, and occupational therapy for others. They have to provide CRNA. They provide CRNA services, so they'll pay for a CRNA to do a anesthesia procedure as opposed to just a anesthesiologist. They cover eyeglasses and contacts, hearing aids. Some services for podiatrists, and then other mental health services are provided in the state of Texas. Now, not every state provides all of those services. The other services, every state's required to cover. Pharmacy services, that only not every pharmacy in the state of Texas provides or accepts Medicaid. So when you have a patient, you have to be sure that that pharmacy does accept Medicaid. Another thing you want to do, in 2012, managed care became a relevant service for Medicaid in the state of Texas. So in our area, there are certain entities that take care of Medicaid patients, which means that private insurance companies now manage Texas Medicaid, where prior to 2012, the state of Texas managed all Medicaid services. So if I was working in a doctor's office and I needed to get a service for a Medicaid patient, I would pick up the phone and call a number at a number in Austin, where Texas Medicaid prior authorizations was housed. Now that is done through, in our area, it's done through Amerigroup, Cigna, Amerigroup, Cigna, United Healthcare. There's one more. But there are 4 companies that manage all Medicaid in our area. And depending on where you live, you have to know which companies take care of your Medicaid. Oh, Amerigroup. Amerigroup. Something with a P. Cigna and United Healthcare. Anyway, you have to know. And so every patient, depending on what group they're in, they have different pharmacy services and different drugs that are eligible. And if they're not eligible, you have to get a prior authorization. And as the medical assistant, that is going to fall to you to do sometimes. It's to know, okay, this patient has Amerigroup and they will not cover this particular medication. And you have to let the doctor know their insurance doesn't cover that. We have to be sure that we give them something that's covered. So and if not, and if it's something the doctor adamantly has, then you have to have your documentation to get that prior authorization done. So just be aware that when you're looking at insurance, if they're Amerigroup, if they're Cigna Health Springs, if they're a United Healthcare Medicaid program, you have to be sure you're aware of what their formulary is. Medicaid providers and requirements. So a Medicaid provider, a doctor, a nurse, physical therapist, a dentist, a psychologist, they are people who can provide facilities. Also hospitals, nursing homes, mental MHMR, mental institutions for people with mental health and mental retardation issues, certain clinics, community health centers, pharmaceutical companies like CVS, any place that provides medical equipment, which would be our durable medical equipment companies, like Healthline is one that's in our area that's kind of a national kind of company. They accept some Medicaid, some they don't. You have to know that. Medicaid providers, anyone who provides services has to be contracted and has to be a partner with Texas Medicaid. And they have to be a Texas Medicaid healthcare partner. So they have to be contracted to provide those services. You can't just call up anyone and say, hey, I need a walker for this patient who has a Amerigroup. It has to be someone who accepts their insurance. Sorry. Medicaid delivery methods, like I said, in the state of Texas, we have managed care. And some of those managed Medicaids, if they are a CHIPS program, they have primary care case management as well. A lot of them do have case management where the primary care physician is responsible for everything else. They're a managed care organization that primary care physician. And so if you get a patient and you look at their insurance and it says that they have a primary care case management and your doctor's not listed, if you see that patient, their insurance is not going to pay unless you have a prior authorization prior to them coming in. So know that managed care, pretty much, unless your doctor's the primary provider listed, everything else has to be prior approved. And let me see if I can open up this managed care program because it will show you. These are all of the different places that shows you who manages those programs. Those are Star Plus Kids, and then CHIPS. So these are the people who provide it. Now, I will tell you, it lists Parkland as something out in our area. Parkland only covers facility care at Parkland Hospital. But Amerigroup, Molina, we have in our area, we also have Superior. That was the other one I couldn't remember. Superior, Amerigroup, Cigna Health Springs, and United Healthcare. Most CHIPS is covered by Molina or Superior, and Star Kids, which is a Texas children's program, is covered through United Healthcare. Though that's in our area. Our area is that gray area, but just understand that it may be different for different places in Texas because that's who's contracted. So wherever you are, be sure that you check this every year because it changes every October. All right, sorry about that, guys. Let's get back over here and keep rolling. Fee-for-service Medicaid. Fee-for-service Medicaid is a traditional Medicaid program. There are certain individuals that can, after they've been on a managed care program for a certain period of time, can choose to opt out of their managed care. At that point, that's when you have to call Medicaid itself again to get you fax everything to them. You don't call them anymore. That you fax for eligibility, you fax for prior authorization to Medicaid itself, to the Texas Department of Human Services in Austin. And the people who have traditional fee for service are people who are not enrolled in a managed program, such as an HMO or that primary care managed program, and they are or people who are enrolled, but the services they need may not be covered by that program. Generally, if they're going to be in a managed program, they're in a managed program. If they're not, they're going to be at the fee-for-service for Medicaid, and you absolutely have to know which one so that you're contacting the right place. Also, they may receive and they may receive services from any Medicaid provider, which is a little different. Those other United, Superior, Molina, any of those other managed groups, the doctor has to be contracted with that specific group, not necessarily just Texas Medicaid. So your provider, if someone comes in with Superior, they have to be contracted with Texas Medicaid and they have to be contracted with Superior. Like I said, I know it's crazy and it's a lot of work and it's a lot to remember, but as the medical assistant, you're expected to know. Provider reimbursement, claims and payments. So there is a specific way, and we are moving into claims and payments because that may be something that you have to be responsible for or to ensure that the Form 1500 is filled out appropriately. Bills must be submitted. Please remember this if you don't remember anything else for your provider. All bills 4, provider reimbursement must be submitted no later than 90 days prior to after the service to receive payment. If a bill is sent 91 days, submitted 91 days, and it's all electronic. If it's submitted 91 days after the day of the visit, and the day of the visit is day 1, the physician will not get paid. So billing has to be done timely. It needs to be done every month. Once a month, people bill for Medicare or Medicaid. Sometimes they bill twice a month. Sometimes they bill once a week, depending on how busy the clinic is. But billing should be done timely. If it's not, they will deny the claim, and your physician won't get paid. And let me tell you, if you get enough claims denied for whatever reason, then eventually you won't have a job. So be sure that you are aware. The home Health and Human Services is responsible for establishing a fee-for-service, the traditional Medicaid. The state determines, and sometimes that changes, so you have to keep up with that. They determine how billing has to happen from the provider and how they're paid. So sometimes you may bill 10 days after or 15 days after your patient is seen, but the physician might not actually receive money for that for 6 months. So that's why it's very important that claims, which is what we call bills, when we bill for a service, it's called a claim. We claim that they owe us money or they owe our provider money. It must be done timely or claims will be denied. Also, it needs to be done timely because lots of times they want additional information, and it all has to take place in that 90-day window. Provider enrollment, so every year, and that may be changing. It may change to every 2 years in March, but right now, every provider has to make sure that their provider enrollment information is updated every year, which means that their license is updated. And I'll tell you, providers will ask you to do this often, and you can. It's legal for you to do it. But whoever's going to, either the claims administrator, if you work for a large clinic, you don't have to worry about this piece. But if you work for an individual doctor, lots of times you'll have to do this or help with this. That means that the contracts are updated, licenses are updated, NPI numbers are updated. All those things are done. And that the provider goes through the appropriate education every year, the continuing education, so that they can maintain their status as a Medicaid provider. Federal Medicaid assistance percentage, a portion of total Medicaid costs is paid to the federal government, is known as federal medical assistance percentage. And in 2011, each dollar spent, the federal government paid about $61 of every dollar. That was the most recent number I could find was from 2011. So in 2011, the federal government paid 61 cents of every Medicaid dollar spent in the state of Texas. And so it's based on the average U.S. income, how much they pay. Changes are made regularly based on the change in federal funding. And so as we vote for our House and our Senate and the federal government, they're the people who determine whether Medicaid has money cut or money added. Same thing for Medicare. Medicare spending is added or cut based on our government. And I will tell you, in the last 5 years, for the last 10 years, every year Medicaid funding has been cut, just like Medicare funding has been cut, which means there's less money available to provide services to people who need it. Okay, guys, that is all about Medicare. Medicaid. Now we're going to talk about CHIPS. So our CHIPS program, that is something that helps. It's Children's Health Insurance Program. And so what that does is it provides insurance to children or support for families who are working and they don't necessarily qualify for traditional Medicaid or managed Medicaid, but they do qualify for assistance for them to have medical insurance. So the family has to pay a certain amount for their kids to receive insurance. So CHIPS federal program, it was created in 1997 under the Balanced Budget Act. under Title 21 of the Social Security Act. So understand that it's part of the Social Security Act, and it allowed each state to offer health insurance for certain children who are not already insured. So maybe the parents can't afford their work insurance, or the work insurance they don't provide health insurance, but they don't qualify for Medicaid. CHIPS was implemented in 2 phases in 98 as a Medicaid expansion for children 15 to 18 for families below the 100% of the federal poverty level. And then phase 2, entitled in 1999, was a separate health insurance program, and the enrollment began in 2000. Currently, there are 1.2 million children who receive CHIPS on top of the 3.3 million children who currently receive Medicaid benefits. Another 1.2 million children receive CHIPS benefits. So sometimes, we wonder where our tax dollars go, and we wonder, about all these different things we do. Well, now you see where some of that goes. So what is CHIPS? CHIPS is a joint federal and state program that provides medical coverage for children up to the age of 19 who are not already insured. So, like I said, it's for, maybe the child doesn't qualify for Medicaid, but they do qualify for CHIPS. So you want to be sure that if a family doesn't think they qualify for Medicaid, just tell them that to apply for these programs, because all they can be told is no. And pretty much all in the state of Texas, all Medicaid and CHIPS applications are done online now anyway. Federal law and regulations require each state to set eligibility guidelines, service levels, and delivery systems, just like you saw with Medicaid, where it gave a list of who could provide services, what services were provided, and where they were provided. CHIPS does the same thing. The federal government required that in this program. Operate a state planning list of these elements. So when they have to plan to improve services as well, and how they're going to provide it. CHIPS is not an entitlement program, meaning the state can determine age and income eligibility. Where the federal government sets out the eligibility for each state for Medicaid, the state can determine age and eligibility. Where Medicaid is eligible for X people by federal law, the state gets to determine that with CHIPS. The state can cap enrollment. So with Medicaid, they can't say we're only going to allow 500,000 people to qualify for Medicaid. CHIPS, they can say we are only going to provide this service to the first 300,000 people who apply, or the first 100,000 people. The state can cap that. The United States can limit service benefits, and approved by the U.S. Secretary of Health and Human Services. So the state can limit benefits as based on the U.S. Secretary of Health and Human Services. Total financial participation is limited to a block grant allocated to each state. So like Medicaid, the state gets a set amount of money every year. For Medicaid programs, they also get a block grant, or a X amount of dollars, and that's all every year for CHIPS as well. CHIPS services, like once again, it's for uninsured children under the age of 19. CHIPS prenatal services for unborn children meeting eligibility requirements as well. In the state of Texas, we do provide it for unborn children. In the state of Texas, the growth income up to, so where they have to be at least at 100% poverty level for the U.S. government. In the state of Texas, you can be at 200% of the federal poverty level. And in a minute, it'll show you. It'll show you what that is. Now, 200% of the federal poverty level also isn't just income; it includes assets. So, like value of car, value of a home if you own one, those kind of things. They must be a U.S. citizen and not eligible for Medicaid to be eligible for CHIPS. So remember, they must be a U.S. citizen or a legal or permanent resident. They have to not be eligible for Medicaid, and they have to have a gross income of 200% above poverty, 200% of poverty level. Families with a net income of 100%, 150% of the federal poverty level must meet an asset criteria. So assets below $10,000. One vehicle of $18,000 or less is exempt, and a second vehicle of $7,500 is exempt. Anything else you own matters. Eligibility is for a year at a time. So every year you have to reapply for those benefits. Cost sharing. So depending on where you are determines how much a family has to pay for benefits for their children. So if someone is at 150% of the federal poverty level or below, which is that list that I showed you, that's the current federal poverty level 2018, they don't pay anything for CHIPS. If they're at 151 to 185%, they have to pay $35 a month. And if they're at 186 to 200%, they have to pay $50 a month for their insurance. And so you see how that can work. Families are required to pay the enrollment fee upon enrollment in the program and at renewal. So they have to pay their fee when they enroll. Now, $50 is for the year. It's not per month. So just know that that the enrollment is due when they apply. Families enrolled in the CHIP program are responsible for co-payments. So there are co-payments for certain benefit plans, and let's look at that. What benefits that they cover and what they have to pay. So if you look here, there's the yearly enrollment fee. Doctor visits when a children is sick and needs counseling. So it shows you based on, and it will tell on their CHIPS card what they're eligible for, but it shows you what their co-payment for a visit would be based on monthly income. So if they're at 100% of the poverty, 200% of the poverty level, it's going to be $5. If they're at below, like that 150 to 185, they're going to pay $20. If it's going to be 185 to 200, they're going to have a $25 copay. This particular website right here, Texas Children's Health Plan, the Texas CHIPS plan, it gives you really good information: cost sharing caps, emergency room visit costs, generic drug costs, brand name drug costs. Those are important for you as a medical assistant to see, so that you know what your patient has to pay, and so that you know that they can, whether or not they can afford it. Current CHIPS benefits. Inpatient hospitals, including inpatient rehab facilities, they have a copay for those also, but they receive that benefit. Outpatient and ambulatory care, healthcare facilities. So that would be like outpatient surgery, if someone needs to go for physical therapy. Ambulatory would be like going to the doctor's visits, labs, x-rays, in a hospital or in an outpatient facility, doctor's visits, physician extender professional services, that would be like surgical or medical services. Outpatient also includes nurse practitioners and physician's assistants. It also includes services like immunizations, well baby check, well child checks, emergency services, prescription drugs, and then these are other things: speech, occupational, physical therapy, home health for someone that needs it, transplants, medical equipment, dental services, hospice care when needed, skilled nursing facilities. So if they needed to go into someone had to have some type of surgery and they had to go in for an extended rehab, that would be through that skilled nursing facility, or they're in a nursing home. Chiropractic services, vision, tobacco cessation, and mental health services. Those are all covered currently under CHIPS benefits. That also it can be changed every year. CHIPS perinatal providers are limited to basic perinatal benefit care package. So up to 20 prenatal visits and 2 postpartum visits. That's what it covers. First 28 weeks, once every 4 weeks, 28 to 36, every 2 weeks, 2 to 3 weeks, and then once a week the last 4 weeks before delivery. That's what the CHIPS will cover. Now, CHIPS is for someone between the age of up to 21. So depending on, hopefully someone anywhere from the time they could get pregnant up until 13, it would pay for that. Additional prenatal visits, if someone is high risk or they're having issues with their pregnancy, additional visits can be received if the doctor gets it prior authorization. There are certain pharmaceuticals that are provided, definitely prenatal vitamins and other things. Laboratory testing is very limited. You usually get 3 prescriptions a month, and one of those has to be your prenatal vitamin. Other assessments and planning services, education and counseling, certain services are available. It also is set on the CHIPS formulary. Hospital facility charges and professional fees based on the pregnancy alone and the delivery, and then there are no cost sharing requirements. So that means generally someone who needs prenatal care under CHIPS does not pay those copays. Delivery models, so they also have managed care, and they have, just like Medicaid, they're based under, like I said, right now in our area, it's all under United Healthcare. Dental services also have a HMO, as well as the eye programs. They have HMOs, or managed programs that cover dental and vision for those who qualify. Federal match rate right now, Medicaid is a federal grant program, federal government program that pays a certain percent of CHIPS. Just like Medicaid, the federal government pays 61% of every Medicaid dollar spent. The federal government pays a higher percentage for CHIPS than for Medicaid. Okay, guys, be sure you take really good notes on this. Because you're going to have a quiz on this, and this will be part of your CERT testing. So be sure that you have watched this video and taken really good notes. All right, everybody, y'all have a great day. I'll be back with you tomorrow.